this is a big announcement that you made for yourself, for your company, and joining Cylinder. So I'll let you make the announcement.
Awesome. Well, today, we've been building Dieta Health for 5 to 6 years. Our mission has been to personalize digestive health using AI. And today we're super stoked to announce that we've been acquired by Cylinder Health, which is the leading provider of virtual digestive healthcare.
I think that it's continual disruption. I think it is being disrupted and will be disrupted. So I think it's embracing that disruption and saying, okay, this is happening. How do we be a part of that disruption? How do we disrupt ourselves and leverage that expertise?
There's a huge opportunity with kind of AI agents to be checking in with patients and making sure that they feel like they're being handheld throughout the entire process. AI kind of gives us an opportunity to take the expertise of clinicians and kind of scale it so it can seem as if each patient has infinite attention from their clinicians.
Asaf Kraus, founder of Dieta Health, and Bill Snyder, founder and CEO of Cylinder. Welcome to the Scope Forward show. This is a conversation that's long time pending, so I'm really excited to have you.
Thanks for having us, Praveen.
Thank you.
So, Asaf, you've been on the show before, and you were also there at the GI Mastermind Conclave last year. Now, this is a big announcement that you made for yourself, for your company, and joining Cylinder. So I'll let you make the announcement first, and then I have several questions to follow.
Awesome. Well, today, we've been building Dieta Health for 5 to 6 years. Our mission has been to personalize digestive health using AI. And today we're super stoked to announce that we've been acquired by Cylinder Health, which is the leading provider of virtual digestive healthcare.
Awesome. So you reached out a few days ago, and this was before announcement went public. You somehow chose to tell me about it and make this announcement on the Scope Forward platform, which I'm flattered. So I am just curious to know, why did you choose to do that versus mainstream media and all of that? I'm sure you would have opted that too, but it's curious to know.
First of all, thanks for having me on the podcast earlier, Praveen. It's been a pleasure getting to know you, and just having attended your GI Mastermind Conclave event in Washington, D.C., DDW last year. I saw basically all of the big gastroenterology innovators, whether they're from biotech, pharmaceuticals, digital health companies, or gastroenterologists from the big practices coming together. And you've definitely been a huge connector in the gastroenterology innovation space. So I appreciate what you do for the community. And last time I came on the pod, a lot of great people reached out. So you have a big platform, and we appreciate you having us on today.
Superb. So let's make use of that. Let me start by asking you, what is the backstory here that led up to this acquisition?
For those who didn't listen last time, I'll give a little bit of an introduction on myself and Dieta Health, the company that I founded. The story goes back to 2017 when I was working as a data scientist at Uber in San Francisco. I was not really interested in healthcare or digestive health by any means. That was the last thing that I was interested in. But the environment at Uber was very innovative. Everyone was obsessed with data and machine learning and personalizing experiences for the customers, which in that case is the riders who click a button, an Uber arrives, and they're treated like royalty at scale. That was the idea, is to give you the black car service, but do so for millions and hundreds of millions of people. Then at the start of 2017, I was afflicted with severe IBS that came up out of nowhere, basically, for me. And it took over my life really quickly, where all I was doing was visiting gastroenterologists, going to multiple different types of clinicians and multiple second opinions of each type of clinician. And they were giving me really confusing recommendations. I also found that they didn't really take into account the data that I was telling them, trying to kind of personalize the experience for myself. Like, hey, these are the symptoms that I'm suffering from. These are the things I've tried and what's worked and what hasn't worked for me. I found that the gastroenterologists I was visiting in San Francisco were kind of treating me in a cookie cutter fashion. And they're actually kind of dismissive of my suffering and the data I was trying to give them. So I thought a little bit why not bring some of the kind of magic that we do at Uber and in Silicon Valley to the world of gastroenterology, collect better data on patients, and then be able to give them better recommendations and ultimately give them better outcomes faster with fewer resources. So I left my job at Uber, founded Dieta Health. We built an app that collects data about gastroenterology. We could get a little bit more into the specifics, but the flagship feature of what we built is stool image recognition. That's instead of the patients looking at their stool and making a subjective assessment of it every day, they can photograph the stool in our app, and our AI makes a superior characterization of the stool versus the traditional standard in gastroenterology, which is the patient observations. So we built this tool. It is kind of like the blood glucose monitor of digestive health is the way you can think about it. It's something that gives you your outcome every day in an objective way. And it also does a better job at characterizing the patient. Which type of disease do they have between the different subcategories of IBS and between IBS and IBD, ulcerative colitis and Crohn's disease. So we built this, validated it, published 4 clinical trials. We had 25,000 patients use our app and collect data. And over time, we realized there's something bigger we could do with this technology. And all that led up to today, us being acquired by Cylinder Health, which is the leading provider of GI care. So they actually provide a virtual clinic, something that we have not done. Excited to share a little bit more about that today.
Congratulations to both of you and both your teams. It's an amazing announcement for gastroenterology as an industry as a whole. So did you find Cylinder, or Bill, did you find Asaf? How did it actually happen?
I have had the pleasure of getting to know each other over the last 5 years. And so we actually connected at some of the different kind of association meetings and instantly hit it off. And the thing about Asaf that I was really drawn to was his passion around building a better platform for providing personalized and incredible care for individuals who are suffering. So that was the thing that stood out to me when I met Asaf. I was like, wow, he is super passionate about this space. And so since then, we've stayed connected, and I've watched his journey in building Dieta and just always been impressed by his entrepreneurial spirit and what he was able to do with his organization. And Asaf, I'll turn it over to you to your experience.
Yeah, definitely. Very early in my journey starting to build Dieta Health, I got introduced to Bill. And when we had this first chat about personalizing digestive healthcare, he gave me a little bit of his background. He was leading sales at Virta Health, a multi-billion-dollar diabetes company. I immediately felt this guy has a big vision for gastroenterology. He is an incredible storyteller and a business operator. So over the years, getting to know him and seeing the progress that he's made, closing these very major partnerships, publishing data that Cylinder Health can deliver superior outcomes at a lower cost, which is incredibly impressive and hard to do, and building an incredible team. Over the years, I've gotten to know the chief medical officer, some of the folks building the technology and the product and the operations. That immediately felt to me like that's a team that I aspire to join. So there couldn't be a better home for us to land Dieta in.
Bill, how is this going to fold into Cylinder?
Yeah, so I think for us, going back to our view of Asaf and what he built at Dieta, there were 3 things that we looked at that got us really excited about the potential for integration into Cylinder's larger vision. And those 3 things were the people, the focus on clinical outcomes and clinical rigor, and then the innovative technology. And so it starts with the people. I mentioned kind of getting to know Asaf and just understanding his passion around the area, his personal experience, and his vision for what he wanted to build. And so that's always the starting point for us whenever we think about bringing people into Cylinder, whether that's people we hire or acquisitions. It's, are they passionate about this mission? Because it's hard to build something new. It's really difficult. It's challenging. There's lots of ups and downs. So you need people that are truly passionate about it, which of course Asaf and his team certainly are. The second thing was focus on clinical rigor and clinical discipline. And so what we saw with Dieta was, they are working on clinical trials that are really, really exciting to us. And so for us, we'll talk a little bit about our commitment to peer-reviewed publication and clinical rigor. That's kind of in our DNA at Cylinder. So that was really exciting for us to see that Asaf and the team at Dieta were so focused on. And then the third was that kind of innovative technology piece. So Asaf has always talked about leveraging AI to predict flare-ups and better understand how we can personalize the experience for each member. And that's something that we've really focused on in building Cylinder. So it was a very natural fit in those kind of three areas that we always look at. So there's always a process of actually integrating the technologies. And so that's where we're kind of starting at today, is figuring out when can we really start to leverage all the great work that Dieta has done and build that into our solution at Cylinder. So we're putting that into our roadmap and evaluating how quickly we can get that to market and ultimately to our patients.
Asaf, back to you. Like, so if you were to reflect on this conversation, let's say by the end of this decade, what should have happened for this to make it like really right for you?
So I would start with, first of all, the scale of the impact that we make. I've been really impressed to see how quickly Cylinder has grown to being able to deliver care to 100,000 members that have GI conditions, and it is rapidly growing. So when we look back in a decade, I would love to say that our technology has made it to millions of patients, because there's over 100 million people on Earth that have IBS and various other GI conditions. So the scope of this problem is very, very big, and I think we have a huge opportunity to get to many, many patients and personalize their care and give them that red carpet treatment. And secondly, I'd love to build further upon this technology. So by Cylinder having the scale of the patients that it treats, as you know, by me being a guy that's passionate about AI requires a large scale of data. And we don't want to just measure outcomes and characterize patients into different groups of diagnoses and subdiagnoses. We want to ultimately use AI to actually personalize their care. The journey today for a GI condition suffering individual is that the GI clinicians often do a guess and check process of like, let's try the low FODMAP diet on you, let's try these fiber supplements, maybe prescription medications. We really want to bring data into the fold so that we can understand earlier what type of condition this patient has, compare them to millions of other patients, and then make a better decision about this is the right treatment for this patient at this time. And that'll really shorten the kind of miserable guess and check experience and get people to superior outcomes faster with fewer resources. So when we look back a decade from today, that's really what I'd love to achieve. And I'm excited to be at Cylinder to try to deliver on that vision.
I'm guessing, one of you or both of you would know, have data on this. Have there been more than 10 acquisitions in digital GI space? It can't be more than 10. It's maybe 5 or less. Like, so what would you say?
Yeah, I think it probably depends on how you define the digital GI space, but I think you're right, Praveen. I think it's been minimal because, this is still, I think, a relatively newer field for digital health. And so I do think it's probably less than 5, depending on how you define it. So
Yeah, there was one in UK or a couple in Europe that I remember. I'm guessing there could be another couple in the US, and then there's you. What do you say, Asaf? Do you know?
So I don't know too many others. So I think you're right on that. I've always had the belief that GI is kind of an overlooked problem in healthcare. There's, maybe Bill, you could touch on this coming from the diabetes space, but there's a lot of different innovative companies on diabetes, mental health, some of these conditions that get a lot more attention. GI is definitely a very hidden thing. It's embarrassing for people to talk about, so they don't really want to come to their employers and their payers and request, for new solutions to this kind of thing. So we're a small field, but we're a bunch of people that are very passionate about this, and that's definitely what your community, Praveen, that you've built, kind of rallied around. And if we're one of the first major acquisitions here to make a dent in gastroenterology, that's something we're really proud of.
Yeah, so that makes this announcement even more historic. So fantastic. But Bill, you were going to say something.
I was going to agree with you both on the fact that it is newer, and for all the reasons that Asaf mentioned, where it's been a little bit hidden, it's been difficult for individuals to talk about and bring up. But what's really exciting is the speed with which individuals and the market are really recognizing the need in the GI space. And so I think we're seeing really fast adoption, large self-funded employers and by health plans. I think that's the most interesting piece, is the health plans who are continually looking at their data to say, hey, where are the problems in terms of spend and utilization? Where is there a need? we've seen them move really, really quickly in terms of partnering with Cylinder to get our solution into the hands of people in need. So I think that's really exciting that GI is a space that is now being so recognized in terms of the patient need.
I have a final question that I'd like both of you to reflect, and then I'm going to do a deeper dive with Bill after. So, which is on the future of gastroenterology? I always ask that question, but I'm going to now layer that with also AI, given everything that's happened in the last 1 year, not just in GI, but not just in healthcare, but the all industries put together, and overall where AI is going, it's racing. I want your both reflections, either independently or collectively now as a team. Where's all this going to go? What are you seeing?
I'm happy to start first. To me, I see it as a little bit like three phases. The first is outcomes measurement and categorizing patients correctly, which is a huge problem in gastroenterology. The second is recommending treatments, so a recommender algorithm. And the third is actually care delivery. So on each of those, I've talked a lot about the first one because that's what we focused on. We published many clinical trials on patients photographing their stools and how can that characterize which type of patient you are and how severe your disease is at a given moment. So I already kind of covered that. The next is that recommendation algorithm of you're a patient, you're confused on what actions you can actually take to improve your digestive health. And that's what we're excited to build next. The kind of longer term vision, I think, is the actual care delivery. So what we're seeing now with LLMs, if you think about many of the big digital health companies, they have health coaches that are constantly checking in with patients, motivating them to take the actions that they need to take every day, especially in digestive health. A lot of these things like low FODMAP diet or some of these medications, they're very difficult things to do. And you need a lot of human touch to kind of handhold the patient through doing them and getting to the superior outcomes. There's a huge opportunity with kind of AI agents to be checking in with patients and making sure that they feel like they're being handheld throughout the entire process. AI kind of gives us an opportunity to take the expertise of clinicians and kind of scale it so it can seem as if each patient has infinite attention from their clinicians. And that's really the big vision, I think. It's generally about healthcare, but it's going to be a huge contributing force in gastroenterology specifically.
Couldn't agree more. And I think when we think about how that aligns with our mission at Cylinder, our view for the long term is to be the most trusted voice in GI care. And so when you think about the ability to leverage LLM and to say, hey, let's really identify and use pattern recognition to figure out how we can best predict the onset and progression of these conditions and the right way to intervene at the right time for each individual patient, that's incredibly powerful. So going back to what Asaf was sharing about the patient journey in many of these conditions where it's almost a diagnosis by elimination, if we can help get those patients the right care at the right time more quickly than anyone else at scale, that's absolutely incredible. So our hope is to partner with leading clinicians, leading institutions across the country so that we can say, hey, we have the best data set to say what the best intervention is at what point in time for each individual at scale. And that's really exciting. And I think that's where AI and innovative technology can play a really outsized role, especially in this condition set.
For a moment, I'd like both of you to disconnect from your respective companies and then envision, given what you know, where these exponential technologies are going, and especially AI, and contextualize that for gastroenterology and healthcare. I'd love to get your view of the future.
I think, when you think about it in context of technology and the current field of gastroenterology, the current field of gastroenterology is you've got incredibly passionate and smart people working in a whole different roles within this area. Let's just take the clinicians as an example. They've spent their life learning and practicing with the intent to help individuals who are suffering. And they have a limit of what they can do. They want to do as much as possible, but they're limited by things like the ability to see patients. So if you're in a brick and mortar setting, you only have the opportunity to see those patients that come into your door. In terms of the time that they have to keep current on new innovations or new clinical information from the latest medication or latest intervention, there's only so many hours in the week. So these clinicians who are passionate about helping their patients, they are torn between spending the optimal time with the right patient and keeping current on all the latest innovations. And so where I see technology in general and AI playing an outsized role is supporting that care and saying, hey, we can help deliver really meaningful insights that are impactful at that moment of time to the provider. And so that's something that's really important for us, is thinking about how do we work with and support those brick and mortar providers in the entire field of gastroenterology to make sure we're bringing innovation to the entire field, not just for our company, but how do we continue to improve the care that's being delivered across the country and support those great clinicians who are working tirelessly to support members. So I think that's where we have a really big opportunity collectively, outside of anything that we're doing at our company. And I'll let Asaf kind of share his thoughts as well.
Yeah, definitely couldn't agree more, and don't have too much to add over what Bill said, but definitely super agree with that. And the way I'd put it is kind of infinite attention of gastroenterologists. If you think about some of the world leading experts like Dr. Mark Pimentel, who's been a strong advisor to both Cylinder Health and Dieta over the years, if you can imagine a future where every patient gets to have Mark Pimentel sitting next to them, giving them advice, telling them what the latest clinical trials show, also reviewing their data as an individual and personalizing the experience for based on who this patient is, what they should be doing, and how they can get to the promised land of digestive thriving much faster. That's kind of the future that I envision. So it's more about scaling the time and expertise of the most expert clinicians, giving the patient as much access as possible to that expertise.
Asaf, this was fantastic. Once again, congratulations to you and to Bill. I'm going to do a deeper dive with Bill now, but fantastic to have you back on the Scope Forward show.
Yeah, thanks so much for having me, Praveen. And thank you again, Bill. And I want to give a shout out to the rest of the Cylinder team for giving us a warm welcome and for being so passionate about this shared mission that we have. So great to see you both, and we'll let you take it from here. Thank you.
Thank you. All right, Bill. So, like I said, I'd love to dig a little deeper with the Cylinder story, and you as well. So I noticed that Kellogg MBA for a long time in Humana, if you allow me to say, on the evil insurance side, and then you decided to switch over to the provider side with Verta and Vivante Health, that is now transformed to Cylinder. So, just I'd love to know what led to what, and how are you here?
Yeah, absolutely. So to your point, I spent over a decade at Humana, and that was a great learning experience. I really did learn the business of healthcare there. My last role there was running the Chicago office. It was a $560 million P&L. Spent a lot of time with providers. So really looking at provider contracting and figuring out, okay, what are the relationships within the healthcare ecosystem? And I think that background has really helped me in my digital health and entrepreneurial experience, because it gave me an understanding of the different parties within the healthcare ecosystem and how do we think about that in terms of delivering incredible patient care. That was a really helpful background. As you mentioned, I spent time at Verta Health, which is a great company, and Sami Inkinen, the founder CEO there, is still a friend and a mentor to me, and I enjoyed watching him build that organization. And my role there was really to operationalize the commercial function. I think of myself as more of an operations person than a commercial person, and so it was really about setting up repeatable process to help them scale and to help kind of negotiate those first contracts with health plans, because that is my background and something I understand. But truly, GI was always a passion area for me. And that's because I had seen loved ones impacted by chronic digestive conditions. And I'd seen the impact that the toll it took on them physically, mentally, emotionally. And I also knew that the journey was one that was really difficult for patients. It was a journey of kind of meandering through the healthcare system, trying to figure out what is the underlying issue and root cause. And when I spoke to gastroenterologists and other providers in the GI space, they were struggling because they had an overflow of patients that needed their time. They were doing everything that they could to provide the best care for their patients. They were overwhelmed. It's 6-month wait time to get in to see a gastroenterologist in many parts of the country. So for me, I was drawn to the space. I was drawn to the problems at hand. And I was recruited into a previous company called Vivante Health. And it was in this space a little bit more broad. And I was asked to eventually lead that organization And one of the things I tried to do there was narrow the focus. And ultimately, in 2021, I decided to start a new company. So we founded Cylinder in 2021 as a new entity, new company. We did buy the assets of Vivante at that time. So we were able to roll that into the new organization, but started the new company with a new mission, new team, new vision, and really realign the product and set our mission as our goal is to revolutionize digital health gut first. So really work with individuals who suffered from these chronic conditions across the country at scale and deliver incredible care to everyone that we work with.
Congratulations. It's an incredible journey, one tying into the other. Did Cylinder fundraise when it got started?
It did, yeah. So we did, when I started the business, we did our Series A in conjunction with the founding of the company. In 2021, I did raise capital from great investors who I kind of went to and said, hey, here's my vision for this new company. And here's what it looks like. Here's the problem that we're solving. Here's what I think we can do in terms of delivering value to the patient and to the entire healthcare ecosystem. Again, I was just really fortunate to have partners that saw that vision, believed in the team's ability to execute against that vision. And so we did our initial Series A fundraise. Now we've done our Series B, and we've just got incredible partners on our cap table.
Is that information public? How much you raised and all of that?
It is, yeah. So, in total, we've raised about 50 million in capital to date. And, again, great partners from Distributed Ventures to Lightforce Capital, to Seven Wire, to Mercado, to Intermountain, Sempervirence, Human Capital. I mean, I could go on, but we've been very fortunate to just have great people involved in the organization. Rock Health was involved with us early on. So, and just really supportive and people that are interested in solutions that have a proven impact on patients.
What was the main reason or the common theme across these, various investors? Not just from a Cylinder standpoint, but why were they interested in gastroenterology? What is their thesis? What does their playbook look like?
Yeah, I think for them, it was what's the size of the problem? And then what's the impact that you can have on the problem? And so the size was obvious when you look at the third party data. We know that the indication rates of these conditions are really, really high. And then you have to dig a little bit to understand, hey, it's a leading cause for emergency room admissions. It is a group of individuals that tend to be higher utilizers. So seeing a bunch of different doctors to try and understand, okay, what is that underlying issue? So it's identification of scope of problem, and then what is the actual impact that you can have? Can you move the needle with these outcomes? Because it might be a big problem, but if the only way that you can move the needle is in face-to-face interventions, then maybe you can't lower that cost of care and create better clinical outcomes. So that was really the setup for most of the investors to say scope of problem, impact on problem, and then how does that culminate in ability to scale?
How do they find everything right now? So what do they tell you, in your board meetings, and when you go back, are they happy with the way, not just your company, but the way industry is progressing? What is their insights here?
I think for us, I think when you look at the market in digital health, there's different stories out there depending on the company and depending on the condition set. I'll tell you, our investors are very happy with Cylinder. And that's evidenced by them putting more money into the business and the growth. We've just been really fortunate that we've achieved incredible growth over the past 4 years and continue to see that. They're very happy with our performance. And I think we are seeing, again, people are recognizing the big problem. We've been able to publish a lot of results on, hey, these are the impacts that we're having from a clinical perspective. We've been able to show strong ROI for our partners and for our patients, which is really exciting. From an investor perspective, they're very supportive and excited about what they're seeing from Cylinder.
Bill, what advice do you have to other entrepreneurs who might be listening or watching right now and thinking, how do I fundraise for GI or within GI?
I think that the biggest thing is helping people see and understand the problem. And just like we had been talking about at the beginning of the podcast, this is something that is a massive problem, but it just hasn't been extremely obvious to individuals. And even when you look back to how health plans traditionally thought about claims and leveraging CPT subgroupers by condition, typically they would group them into some pretty big headings, right? So like, for instance, MSK would be a big category of spend, and then underneath you'd break down, here's the claims for necks, knees, shoulders, hips. Well, there was never a digestive health bucket, right? Instead, you add buckets of ulcerative colitis, of Crohn's, of irritable bowel syndrome, of GERD, of undiagnosed conditions. And so the costs were spread out over all these different buckets. So there was no blinking red to say, hey, here's all this spend in this broader GI bucket. That's been changing. And so what we're seeing is the health plans and the third parties recognize, ooh, this is a really big spend category. A lot falls under this larger umbrella. And so I think for entrepreneurs who are going out to fundraise in this space, it's getting investors comfortable with that and showing that there's been this inflection point in market to truly understand the costs of these conditions. And so I think the more that entrepreneurs can tell that story, that's exciting to investors to say, hey, this is a really big market and there's a lot of opportunity here for improved care and improved patient experience and ultimately lower cost in the healthcare system.
How big is the market? I'm sure you've computed the size of the market for your investors, and it'll help others who are listening on how they can look at it and convey.
Yeah, for sure. So I think, there's huge ranges, right, in terms of how you calculate it. $136 billion is one number that comes up a lot, which is total spend in the GI category. And so I think then you can further break that down to what market you're going after. And the other thing for entrepreneurs that especially are in healthcare, I always counsel that you make sure you understand kind of the picture of the market. And it doesn't mean you have to be an expert in all things, insurance, for example, but to understand the difference of the commercial market, fully insured versus self-funded market, Medicare, Medicare Advantage, Medicaid, dual eligibles. Understanding which population you're trying to serve first is really important so that you don't spread yourself too thin and that you understand what it is that those patients and those partners are looking for. So I think that's how you can further segment the market, but ultimately it is really, really expansive in terms of the total spend that we're seeing in GI.
Now, I learned and I heard Asaf also say, you've seen 100,000 patients so far, and you founded the company in 2021. That's about 4 years ago. That's rapid growth. I want to know if you have to shortlist the primary reasons for your success and this rapid growth into, let's say, 3 bullets, what would that be?
I think for us, the 3 bullets, it starts with improving our clinical outcomes at scale. The second would be focusing on creating a magical member experience. And then the third would be working within the healthcare ecosystem and understanding the importance of the partners. And so from a clinical outcomes at scale perspective, it's can you prove your clinical outcomes and can you publish around those clinical outcomes? So we have multiple peer-reviewed publications and we're not stopping. That is in our DNA. We're continuing to publish because we think that that's essential, especially in digital health. And so we've got these great publications out there that show 89% of the individuals that we're working with within published studies show symptom reduction. 93% of higher acuity patients show symptom reduction and more control of their condition. From a ROI perspective, we're showing reduction in emergency room visits, reduction in duplicative doctor visits, improved medication adherence, overall lower hard cost within the first 12 months. And an incredible experience. People really enjoy going through the Cylinder platform and the Cylinder experience. And then the third is that ecosystem. It's understanding the partners. It's understanding how you work with and support the providers out in the brick and mortar community because they're essential. And so for us, we're working closely with those providers and also working with these distribution partners like the health plans, which have really helped us scale across the country really quickly.
What would make this go 10x from where you are? So, for you to get to 1 million patients, what needs to happen?
I think there's 2 things. I do think the first is that continued education in the market of, hey, this is a massive problem. And going back to what we were talking about at the beginning of the podcast, there's these great solutions out there solving very real problems. So I talked about there's great companies in the MSK space, great companies in the space working with patients who suffer from diabetes. That is incredible to see. Great work in the mental health space as well. And so I love to see these companies that have grown, that have reached so many individuals in need, I want the same thing for GI. And so I think while the market has really started to understand this need, and we're seeing it in the engagement and enrollment rates that we see, which are really, really high compared to other digital health solutions, I think it's getting now that to the mainstream where every employer, every health plan is kind of on that same page to say, okay, this is a major issue that our people are suffering from. And so we need to provide them a solution. So I think that's first point. And then the second is continuing our work with our trusted partners. I mean, we've got so many great partners that have been terrific for us in terms of expanding our reach and telling our story. And so it's continuing to foster those relationships over time.
Excellent. So two related questions, Bill. Like, what is Cylinder's operational model and what is the business model? How do you make money?
Yeah, so from an operations perspective, we are a digital health platform. So individuals come onto our platform, they do a quick clinical intake, and then we try to personalize the experience by delivering them an evidence-based clinical pathway based upon their unique condition and or symptom. And that's really important in this space because, as you know, there is no single biomarker to tell you how is a patient doing. We treat patients that come to us and say, I've been diagnosed with ulcerative colitis. I've been working with a gastroenterologist for 10 years, but I'm looking for better support in between visits. All the way to patients who say, I don't have a diagnosis. I have no idea what's going on, but I have abdominal pain and chronic constipation. I don't even know where to begin. So because there's such a broad spectrum of patients that we treat, it's really important for us to make sure that we can personalize that experience with our technology. And then we wrap that with our coordinated care team. Another thing that's unique about Cylinder is we actually have two products in market. Our core product, where the care team is made up of health coaches and registered dietitians. With that team, we're licensed to practice medical nutritional therapy in every state. So those are employees that are working closely with the individuals in concert with our platform and our technology. Our second solution is our full stack virtual clinic. So that includes a coordinated care team of health coaches, registered dietitians, gastroenterologists, and internal medicine specialists. So in that sense, we're able to diagnose, we're able to prescribe and titrate medication, order labs, and do full clinical workups from our clinicians as well. So two slightly different products in market, and our partners can choose between the two depending on what their need is. And we found that to be really effective to give organizations choice in the model.
When you say partners, you're referring to employers and insurance companies or both? Like, please explain.
That's exactly right. Employers, insurance companies will be announcing a big launch with an integrated health system coming up this year. So in that scenario, it's both the plan and the providers. So it's a variety of how we see that partnership world. But that's exactly right.
Could you name some of them just for context for people listening?
Yeah, for sure. I'll be co-presenting next month with the team from Texas A&M University. They're a great partner of ours. US Foods. We've got a number of the major health plans that are partners for us nationally. So really a number of blue chip clients across the country. So Fortune 50 organizations that have looked at the market and chosen Cylinder as the digestive health solution of choice for their members.
And what's the big benefit that they're getting by utilizing you?
Yeah, so going back to kind of how investors think about this space, a lot of times it's similar with the discussions that we have with employers and health plans. Number one, is it a big enough problem for me to solve? Because, when you talk to the organizations, the employer organizations, they're heavily burdened as well. A lot of the times, the total rewards folks, the HR benefits folks have a lot coming at them, and they're tasked with so much. And so if they're going to solve a problem, typically they're looking at, is it a pretty big problem? Does it affect a lot of people in our organization? And then if the answer is yes, it's okay, now I've got to go look at the organizations that are focused in this area. Can they show proven clinical outcomes? And then can they reduce the healthcare spend? So they want to provide a great experience for their members, and they want to show that this can actually reduce the cost of care for that individual and for the organization. And so for us at Cylinder, it starts with telling our story around the patient experience that we can provide, where we're going to create a magical patient experience where people are really excited and happy about working with Cylinder. And then we want to come back and show them, hey, we're improving clinical outcomes at scale within your population, and we're saving your employees and the organization money by reducing healthcare cost. And something that we've always done from the beginning is put performance guarantees for every contract that we do. And that's, we guarantee clinical outcomes, we guarantee ROI, so financial outcomes, and we guarantee an incredible patient experience. And so we've never had to pay out on a performance guarantee, and we're really fortunate that our partners and clients have been really happy with what we've delivered.
Now, there are other solutions in the market, like Oshi comes to mind. There's another company, WovenX, and there are startups in the IBS space, such as Able Health. They focus exclusively on one aspect of GI. How does Cylinder differ from competition or what exists in the market as of today?
I think I would say what I'm excited about is that there's a lot of organizations focusing on solving this problem. This is a problem, again, that's near and dear to my heart. So anyone who is working on making the experience better, that's great, because I think it is a massive problem and it needs multiple organizations trying to focus on it and fix it. For us, I think we think in terms of what is Cylinder doing as opposed to, hey, what is the competition or other organizations in the space doing? And so when people ask me, why is everyone choosing Cylinder as the solution, I think what we tend to hear is amazing clinical outcomes at scale and the published results. I keep going back to multiple peer-reviewed publications, our clinical improvements on our ROI. We did a great publication on the impact that we have for individuals higher on the social vulnerability index. So when we think about health equity, we've been able to prove that for those higher on that SVI, we actually have an outsized impact. So it comes back to those clinical outcomes. And then I think just our ability to work within the healthcare ecosystem and say, we've always worked well with brick and mortar providers, integrated systems, making sure that we get patients to the right care at the right time. That's what we've heard from the market as a big separation. And then as a future state, I think our continued investment in innovative technology. So as we've talked about with this acquisition of Dieta, we see that as just a very core part of our long-term vision, is to say, hey, technology is going to continue to play an outsized role in the personalization of care at scale. And so we want to continue to be on the forefront of that. That's where we are, and that's where we plan to stay.
I want to do a thought experiment. Let's see. My work is a lot more involved with AI, right now. So I'm curious to see how you might respond to something like this. Now, the way AI is going and shifting gears to even the world of AGI, artificial general intelligence, when AI's abilities will far exceed the collective human intelligence. When that day comes, all the strengths that Cylinder has could be disrupted. So how do you tackle that? So pretty much, let's say, the AI agents running different things, being health coaches, and patients approaching an AI health coach versus a human coach, and the diet charts are being expertly recommended by AI. I know you made an acquisition, to detect stool pictures and classify them and all that. But with more data, maybe a generative AI should be able to do that. And I can go, on and on. With that degree of disruption, what would you do?
Yeah, it's a good question that we talk about a lot at Cylinder. And I think for us, one of the starting points is who's got the best data. So who is collecting the information to help predict those decisions? And so at Cylinder, when we work with our individuals, we're understanding what is their need, what are their symptoms, what medication are they taking, what are they eating. And that helps inform the care plan that we're delivering back to the individual. It helps with that personalization. And so I think the starting point is going to be who understands the need of the patient best to help deliver that outcome, regardless of what technology is being used. And so for us, I actually see that opportunity as a further differentiator for us, because we will be in a position to really leverage the longitudinal data set that we're creating to help finalize our prediction on that onset, on that progression of these conditions, on the right intervention at what time. I'm excited about that as opposed to nervous about it. And then I think it's for companies outside of not just GI or digital health, but one of the things that we do at Cylinder is we have a mandate that everyone should be utilizing AI in their work today across all business functions. And so because this is change, the change is happening. And so you can't be kind of on the sideline looking at it. So we're trying to be very forward thinking about how do we utilize the upside of these changes to make sure that we're providing the most efficient and effective care at scale.
I love your response, but I'm going to frame the question differently. What would need to happen within AI for Cylinder's current operating model to be completely disrupted?
I think that it's continual disruption. I think it is being disrupted and will be disrupted. And so I think it's embracing that disruption and saying, okay, this is happening. How do we be a part of that disruption? How do we disrupt ourselves and leverage that expertise? And that's certainly what we're doing. We're saying, hey, let's create backroom efficiencies. Let's leverage this pattern recognition. Let's optimize the care that's being provided so that when our clinician sees a cylinder patient, right there we already know, hey, this is likely the best path forward for them. Now, we personally still want a clinician to make that decision. So our clinicians are still making the final call on whether that's the right course of care for the member or not. And I think that distinction has been really important when we're talking to our members and when we're talking to our partners about building that trust, to say it's not just AI reaching out to you, that it is our people making that decision, but creating those backroom efficiencies. So I think for us, that disruption is happening. We want to be part of it. We see value in the disruption. And I do think time will tell in terms of how rapidly individuals begin to trust that next level of AI, to say, hey, I'm comfortable receiving all my care from a bot, from AI. Today, what we see is we want our clinicians and our care team members to have that final say, to have that interaction with our patients, but to leverage the efficiencies of AI to make them more efficient delivering that care.
Is there anything else that you want to share with me and people listening?
I think, just one last thing on Cylinder. We've talked a lot about the work that we're doing. We talked about the acquisition with Dieta, and I think the big thing for us in terms of, I talked about the outcomes that differentiate us externally into the market, but the core thing is the people on our team. We do have an incredible team at Cylinder who are all really passionate about the work that we're doing, and none of this is possible without all the work that they do every single day. And so that's certainly when people ask me, like, hey, what are you proud of about all these accomplishments that Cylinder had? I'm like, it's the people. It's the team that we've built, because they're absolutely phenomenal. And then the second thing that I would just say is, I talked to you about this before, Praveen, but I really appreciate your work. I think between the podcast, between the newsletter, just bringing more attention to the GI space in general is incredible. So I just want to say thank you for the opportunity to talk to you today, but also for the work that you do every day in bringing the attention to this space.
Absolutely. So, Bill, thank you so much for coming on the Scope Forward show. It's been a very insightful conversation, and once again, it's fantastic that you made the move, and so did Asaf. And you're making this announcement. You're making this happen. It's great for GI. It's great for the industry. So, I wish you all the best once again, and congratulations.
Thank you, Praveen.